Have a seat, everyone, please. We're going to start again. Well, I can tell from your conversations you found the morning as riveting as I did. So thank you for coming back from break. I'll give one more few seconds for people to find their seats. I really enjoyed our morning speakers, and I'm excited to continue. We've got 4 more speakers before we're done for the day and head to public comment this afternoon. We're now going to move on to aspects of the WIC shopping experience. We've heard from this morning's speakers that there can be some challenges in that arena. I think there's also some parts that are more successful. So what I'm going to do first is invite up Dr. Elizabeth Racine as our next speaker. Dr. Racine is an associate professor of public health at the University of North Carolina at Charlotte. She studies the factors related to healthy eating and physical activity among different populations. Most of her work is in partnership with local school system, hospital system, childcare system, and health department. And when I read that, I thought, oh my gosh, she works everywhere. In addition to her community projects, she also studies the impact of food assistance programs on food security, health, and well-being using primary and secondary data sources. In the 90s, Dr. Racine worked as a local agency WIC nutritionist, yay, in the Anacostia neighborhood here in Washington, D.C. She obtained her DRPH at Johns Hopkins Bloomberg School of Public Health with a focus on maternal and child health and health economics in 2003. So, Dr. Racine, I've lost you in the crowd. There you are. Thank you for being here and welcome.
Hello. I'm going to try to adjust this a little bit. Can you hear me okay? Okay. Well, thank you so much for having me here today. This is kind of seems like my WIC career is coming full circle, because in 1994 is when I started working for WIC over here in D.C., but on the other side of the river, on the east side of the river. So it's really kind of interesting for me to be kind of at the federal level right now. I've always worked at the local level. Okay, so I'm going to talk to you about some work that we've been doing in Cabarrus County, North Carolina, and I'll just go ahead and get started. So first, I want to acknowledge my project team. Most of these folks are at UNC Charlotte. I also work with Amina Batata at UNC Asheville. These are the folks that have helped us with our data collection and our data analysis, and a couple of them are economists, Dr. Shapiro and Dr. Zalante, who have been helping us with the behavioral economic concepts we've been trying to incorporate. I also want to acknowledge our funding sources. So I'm going to basically be showing you research from 2 different projects that are very similar. A lot of them used the same participants, but we're looking at different research questions. So these were funded by Cabarrus Partnership for Children, which is an organization in Cabarrus County that provides child care subsidies to children in Cabarrus County, as well as North Carolina Smart Start, which is kind of the umbrella organization for that, and also the Duke UNC USDA Becker Center. So here is a map of North Carolina. I've highlighted here where Cabarrus County is, and I'm going to tell you a couple fun facts about Cabarrus County, so we're all going to kind of transport ourselves to Cabarrus for a little while. So Cabarrus County is just north of Mecklenburg County. Mecklenburg County is where Charlotte is. And UNC Charlotte borders pretty much Cabarrus and Mecklenburg. So I do most of my community work in both Mecklenburg and Cabarrus. So Cabarrus is famous for a couple things. One, it's pretty much the #1 travel destination in North Carolina. And that might be surprising to you, but the reason for that is 2 things. One is the Charlotte Motor Speedway, which is NASCAR. Okay, and about a mile away from the Motor Speedway is Concord Mills Outlet Mall, which is considered the #1 travel destination in North Carolina. If you look on their website, that will tell you that. It is a pretty fabulous outlet mall, I must say, and it's shaped like a speedway to kind of go with the whole NASCAR theme, and it's wonderful for mall walkers. Yeah. The other kind of interesting thing about Cabarrus County, which I just learned last night when I was going on Wikipedia, is that the first gold discovered in the United States was discovered in Mecklenburg County by a 12-year-old boy wading in a creek. And it was a 17-pound shoebox-size piece of gold. So that's kind of where and this was like in the late or maybe early 1800s, so that's where the first kind of gold mine started in the United States. So now you should feel like you kind of understand a little bit more about Cabarrus County, but I'll also tell you a little bit about the economic history of Cabarrus County. Up until very recently, the primary kind of employment opportunities in in Cabarrus County were farming and textile mills. So Concord Mills, Cannon Mills was a textile factory that made towels for over 100 years. So if you've ever had Royal Velvet, Field Crest, Cannon towels, chances are they were made in Cabarrus County. And in 2003, with globalization, et cetera, that closed down, and it was the biggest mass layoff in North Carolina history. And it really, really negatively impacted Cabarrus County. So they've been trying to think of fun and exciting ways to rebuild themselves ever since 2003. Okay, so I'm going to tell you a little bit about why we started doing some work in Cabarrus County, and this is one of the statistics that kind of caught the local community stakeholders' attention, and this is related to childhood obesity. We are doing a number of projects in Cabarrus County related to childhood obesity. And if we look at the stats from the Pediatric Nutrition Surveillance System, which, by the way, ended in 2011, which I think is very, very sad. I don't know if any of you had any influence in that. Let's talk, because I don't understand why we can't see this data anymore. But anyway, you can see that the rate of a childhood obesity for 2 to 4-year-olds in Cabarrus County was quite higher in Cabarrus versus the US and North Carolina in general, and same a little bit with overweight. And then I wanted to look at how the Cabarrus County WIC population compared to the US WIC population in general. So while Cabarrus County is vast majority white population, I think about 75% of the population in general is white. When you look at the WIC population, you've got a different demographic going. So we've got about 38%, 38% of the WIC population of 2 to 4-year-olds was white, 22% black, and 37% Hispanic. So that's not that different from the US WIC population in general. So I'm going to talk to you a little bit about our research findings for a project we did last summer. Okay, this again is kind of a combination of funding from Cabarrus Partnership for Children, who are really interested in managing childhood obesity for child care center participants, and the Becker Center, which is really interested, they were really interested in understanding the WIC shopping experience for WIC participants. So we basically were doing focus groups, basically 2 focus groups in one. Half of the questions were related to parent choices that they make when they're feeding their children, and the other half was really focused on what the WIC buying experience is like. And I'll tell you, the Cabarrus Partnership for Children was really interested in this because they fund one of our research projects where we're working with 14 child care centers in Cabarrus County doing some really intensive nutrition and physical activity education with the child care center cooks, the center directors, the children themselves. But in this year of the project, we didn't have a parent component. And they really wanted to figure out what were the needs of the parents. So that's why we were doing the focus groups, really to see what were the eating behaviors of these families with young children, and what they thought about, and all that kind of stuff. So I'm going to present a little bit of that. Part of what we did for Becker was also to do a literature review to see what's out there in the literature regarding healthy food choices made by low-income people. Okay, so I'm going to talk just for a couple slides about the literature review. I'm not going to focus on this too much, but I'm just going to tell you that when we were searching the literature, looking at the food choice behavior of low-income families, there wasn't as much out there as I thought there would be. We found about 23 good articles from these sources listed here. And these were the primary themes that we came up with, which weren't a big surprise to us, especially because we've done a lot of qualitative work in the Charlotte region for the last few years. So this is what we kind of see coming up and up again. One thing that I'm always surprised about when talking to low-income shoppers is how much they focus on their shopping. Compared to myself, who I have a store down the road, I always go to that store, I don't really think twice about it, I just go. They spend a lot more time and energy focusing on planning where the best deals are. I go to this store because canned beans is on sale, I go to that store because ground beef is on sale, etc. So this issue of time scarcity and strategizing is one thing that we saw in the literature, but also confirmed what we've been seeing in qualitative studies. There's also this issue of prices at neighborhood stores, like not wanting to go to your local store. We've done some work in Charlotte around food deserts, and we found that a lot of people don't actually shop in their neighborhood. They'll drive 6 or 7 miles outside of their neighborhood to get the best deals, and also because they think that the characteristics of the store in their neighborhood is subpar, and because the prices they think are too high. So they'll leave their neighborhood. So this adds more to the time costs, etc. Okay, so on to the qualitative findings. So basically, because this was a merger of 2 projects, we interviewed or did focus groups / interviews with about 49 parents. I think all of them were moms. 30 of them were WIC participants. And this was done in child care centers at first, but we had a really hard time recruiting people in the child care centers. So basically our strategy was to have focus groups in our child care centers that we were already working with as the moms were picking up their kids at the end of the day. It didn't really work. They wanted to get in and out, etc. So it quickly changed from focus groups to interviews, because they were willing to stop and talk to us for 15 or 20 minutes one-on-one, but they weren't willing to come and sit and wait for 15 or 20 minutes for 3 or 4 other moms to show up. So we had some problems recruiting at child care centers, so then we started moving over to WIC clinics, because we knew, having been a WIC nutritionist myself, that there's lots of moms waiting in WIC clinics in waiting rooms around the county. So we did half of I would say maybe a third or a half of the interviews in child care centers, and then we moved over to WIC clinics. And this was done about this time last year. And we had a number of questions that we were asking, as I already described. And then we used NVivo also to analyze the qualitative results. All of the interviews were audio recorded and transcribed, and then put into NVivo for coding. So the first couple slides I'm going to show you are for the whole group, the 49. So the majority of these women were on WIC, but not all of them. And I'll tell you that the demographics of the child care centers we work with tend to be the lower income centers, and that's honestly because we can't get the higher income centers to play with us. The big chains of the child care centers don't really want to participate in our weight loss initiatives. So these are kind of mom and pop child care centers, which tend to accept these stipends so that parents can have some support for the child care center. So while about 30 of the 49 were on WIC, I would say that the vast majority were relatively low income. Okay? But these were the main themes that came out: their perceptions on healthy meals, their ideas about food guilt, which I would say this is kind of parent guilt about what they're feeding their kids, and also issues around meal planning. So one of the first questions we asked in the focus groups was, what do you think is healthy? Because as we know, everybody has a different definition of what's healthy, right? These are mainly the kinds of things that we heard. They think that a healthy meal is a balanced meal. When we'd ask people to give examples of a healthy meal, they would say, some kind of meat, maybe pork chops or hamburgers with some kind of vegetable and some kind of starch. That's standard what we heard. But then when we asked, do you typically offer this? A lot of times they would say, no. We just feel so rushed, so overwhelmed, that we would like to have it this way. It's not always this way. And then we also heard this idea of, when I put effort into it and I cook for my family, it's healthy. When it's just me, not always. So they definitely put more focus on cooking for their children than what they would normally eat themselves. And this issue of planning came up again and again and again. I think, like I said, we do eat healthy, but we would eat more healthy if I plan. But I'm not a planner. Okay? Okay, child food consumption guilt. All right, I think you got to understand this in the context that every mom that we were talking to also has their child in daycare. Okay? So if you've ever been in this situation yourself, you know exactly what I'm talking about, right? This is very, very hectic time in a woman's life, right? Trying to run from the job to pick up her child before it closes, being exhausted at the end of the day, etc. So these are some of the quotes that we heard. I don't have time. I put my kids to bed at about 8:30 so that they only have 4 hours from when they get home from school and everything else you have to do. So all the other domestic chores that women have to do once they get home. I try, and this is basically trying to provide healthy meals. I try, but time and energy, I have good intentions, but following through sometimes falls flat. And this other one was, I like less breads, and like my oldest, loves breads and starch. She and I are having the hardest time with weight management. So also kind of about food preferences and knowing what you should do versus what you actually do. And meal planning. We were having the discussions earlier about nutrition education, and as a WIC nutritionist myself, I've done a ton of nutrition education in my life, and I've kind of come to the point, especially when I talk to our local community about the importance of nutrition education. I always say that nutrition education is necessary but not sufficient, and I think that the whole planning piece is so, so important. Because I think so many women or women or men or anybody knows what to do. They just are too time stretched to actually do it. But that's just my own kind of take on it. But I think here's what we kept hearing about with meal planning. I make a list, I look at different ads, I see what they have on sale. Sometimes I base what I buy on that. Last night I stopped by the grocery store on the way home and picked up the rotisserie chicken. So I appreciate that there are healthier options as opposed to McDonald's and double cheeseburgers. The last one, the biggest thing for us is just taking the time to plan and prep on the weekends so that during the week we're ready to go. Okay, so these slides from here on out are specifically with the women that are on WIC. Okay, so this is based on those 30 women that we talked about before, and this kind of dovetails really nicely from the previous presentation because we're seeing a lot of the same things that Harry and his team were seeing in Virginia. Okay, so one of our questions was, what WIC store do you go to and why? And this is something that would be relatively biased because in Cabarrus County, while there's a number of WIC authorized stores, there's one kind of favorite. There's one that does a very, very good job of labeling their WIC foods and seems to cater to the WIC population. And then there's a number that, for whatever reason, I guess don't, or the WIC participants just don't like that much. But they said that they primarily redeem their WIC benefits at their regular store, and this is usually a grocery store that kind of caters to lower income folks. They go to stores that label WIC items well and have rewards programs. Very few go to convenience stores. So in Cabarrus County, there are some convenience stores and small ethnic stores that that are WIC authorized. But for the most part, they did not go to those stores. Now, one limitation that I'll mention right now is when we did this study, we didn't have the resources to have a bilingual staff. So as a result, Spanish-speaking or other language-speaking women were not interviewed. And I think that that is a major limitation of this study because from anecdotal conversations with the Cabarrus County WIC director, she told me that the Hispanic population tends to go to the smaller Hispanic-focused markets, which set up their WIC operation much differently than the grocery stores do. And if you want, I can tell you a little bit more about that at the end. But I would say that if somebody was going to do this study again, to do it specifically with the Hispanic population in a community that not only has big major grocery stores as WIC authorized, but also these smaller bodegas. Okay, so when we asked people what store and why, this was one of the kind of the typical quotes that we got. One voucher can have the list of everything: eggs, milk, cheese, bread, beans, all that stuff. And again, in Cabarrus County, they have vouchers. They don't have EBT WIC yet. Then you have some that have just milk and eggs. So yeah, I use it up the street at the convenience store when I don't have a whole voucher. So this woman, when we were saying, do you ever go to the convenience store to use your WIC benefits? She said, well, if it's a small voucher that only has 1 or 2 items that are kind of your standard items, like milk and cheese or whatever she said, milk and eggs, then yeah, I'll go to the convenience store. But if it's a bigger voucher where there's a lot of items on it, I'm going to go to the grocery store because I know they have all those items there. Okay, what store do you go to and why? Like the previous speakers were saying, there's inconsistent knowledge of the WIC approved items at the store. So I assume this has something to do with the computer systems, the scanners, and something to do with the aisle labels, and something to do with the cashier. So I think that there's multiple issues probably going on here. But I think that for the women, it's very frustrating when they go to one store and it's WIC approved, and then they go to another store and it's not WIC approved, okay? And this is within the same state, right? So here's a common type of quote. Store A is the one that keeps up with their labels. I went to store B and spent my last WIC voucher, and there was this sweet potato and corn mixture that they have at store A with a WIC label in front of it, but then I ran it up at the store B register and it didn't go. So, and as we've mentioned in the last presentation, going through the checkout line and being rejected and told that whatever you're trying to put through the machine or trying to get doesn't work is very embarrassing and time consuming. So they'll do whatever they can to avoid that embarrassment and that. So another quote about why you go to a certain store. They want to avoid getting the wrong item at any cost, okay? It causes inconvenience for the WIC participants, the store staff, and other shoppers, okay? So I can go back, but if I see people behind me, so this is if the scenario is that she has gone up to the checkout counter and whatever she has tried to purchase, the store staff, for whatever reason, says is not WIC approved, she'll say, I can go back, but if I see people behind me and they are making faces and stuff like that, I just let it go, meaning that I just don't purchase it, and I just get whatever else goes through, and I'm on my way. Okay, we asked a question about loyalty cards, like do they use their loyalty cards? One of the things that the Becker Center was interested in is on the question of price, and do WIC participants consider price, and kind of looking at WIC food costs and that sort of thing. So we asked about loyalty cards, and everybody we asked said that they use their loyalty cards when they make their WIC purchases. So you could think that if you have your own loyalty card at your own grocery store, if it's going to benefit you and you're paying cash, yeah, usually you're going to use your loyalty card. But if you're using your WIC benefits, where that benefit may not benefit you directly, but it benefits the WIC program, are you going to use it? And the thing is, yes, they do. And why do they use it? Because usually in some way it does benefit them, especially if it's a store that has some kind of perks where, you know, the first $800 that you spend, you get, you know, a cooler, or if you, you know, you get gas perks. So one of the grocery stores in our county does give out gas perks. So the amount of money that you spend at that store, whether it's with your WIC voucher or SNAP or cash, whatever, if you're using that loyalty card, it builds up points that you can use to reimburse for gas. And then also if something is on buy one, get one, you use your loyalty card, maybe you were buying 1 box of Cheerios, now you get 2 boxes of Cheerios, kind of thing. So everybody was using their loyalty cards. They said that it really helped them when they increased their amount of fruits and vegetables that they can purchase, and also if it applies to their coupons. And here's a couple of the quotes. The loyalty card knocks the price down and helps on produce. I spend my vouchers at store C so I can get the fuel perks, and can use coupons with the vouchers. And then we asked some questions about how they know what's WIC approved. So this is one thing that's going to be super inconsistent by state, because we're working on another project right now with my students who are looking at all of the WIC authorized lists throughout the country. And WIC authorized food lists throughout the country vary quite considerably, as you probably know. And what they give out to the clients differs considerably by state. So in North Carolina, if you look at the WIC approved food list, it's got one of those thick clips on it, because there's probably 30 or 40 pages that the client is given. Say, here's the WIC approved foods, okay? Very, very complex, okay? So when we asked people, is it difficult, how do you know what's WIC approved? Tell us what it's like when you first start using the WIC program. This quote, I think, sums it up perfectly. In the beginning, it takes forever. Then we just buy the same things after that. Then the size and the brand will change, and that throws us off. The booklet is helpful, but it changes. Store A tends to just WIC label their store brand only. So basically what we heard is that it's very, very hard at first for them to understand how it all works. And they're kind of nervous when they go to the store because they're going to buy up a jar of peanut butter. Well, is it the right brand? Yes or no? Okay, now that it's the right brand, is it the right size? Yes or no? Okay, same thing. And then with the more complex foods, it gets more complicated. So a lot of times what they do is they figure out what works, what goes through the line smoothly, and they keep doing that same bundle all the time, okay, because they know that it works. And this issue of the sizing of the containers was what tripped them up the most. Okay, the brands, and if you look at a lot of the WIC authorized food lists, they'll mention a lot about the brands. They don't often say that much about the sizing, because different stores you go to, different model years, the size of the box could change, right? And that's very confusing. Okay, so then we asked people if they consider price when they're picking out their WIC items. And they said for fruits and vegetables, definitely yes, of course, because the structure for the fruit and vegetable vouchers is quite different than for the other WIC items. So I'll just read a couple of these quotes. When asked about do they consider price, one of the women said, "No, I don't consider the prices, because if I did, I would be too stressed out. It's already stressful making sure I have the correct ounces, containers, brands. No, I don't really look at price. The only time I look is when I can use coupons with my WIC items to get buy one, get one free items on the cereal and peanut butter." So price is really not a consideration for WIC participants unless they're looking at fruits and vegetables, because they want to maximize their fruit and vegetable purchase, and they don't really want to go over for the for the fruits and vegetables. So they want to make sure that whatever they're buying stays within the cash value amount. Okay, so then we asked, are there things on your WIC voucher that you will sometimes buy through other funding mechanisms other than WIC, if you've run out or whatever? So do you ever use your SNAP benefits or cash? And they said for the staples like milk and bread, they will use their own cash or SNAP. But they'll also buy foods that complement their WIC purchase. We heard this a lot. So here's one. I use the WIC and get Chex cereal, and I make trail mix for the children, and I use the money for the cereal my children like. So there was definitely a lot of talk about the fact that maybe some of the foods on the WIC food package their kids don't love, so they have to be creative with it. So they'll purchase it, but then maybe make something else out of it. And then that maybe frees up some money for them to use on items that their kids are maybe begging for. Another one was, I use WIC for the 1% milk, but buy the Nestle Quick strawberry or chocolate mix with my own money so that they'll drink it. Do you consider children's preferences? This was really interesting, and somebody should study this. Many said, no, I'm the parent, I make the decisions. But then when you ask, but why didn't you buy this or not? And they'll say, well, it's because my kid won't eat it. Well, it was really interesting. Yeah. Do you purchase everything on the voucher? Most of the folks said, yes, we purchase everything. And a couple said they avoid the foods that maybe there's a household allergy, and many said that their children don't eat the WIC cereals. And here's a quote that said, yes, I buy everything on the voucher. It just takes a while to use sometimes. I have a stockpile of beans. Again, do you purchase everything? A few said that they give some of the items away. And this was one of the focus groups that was in a child care center, and this particular woman said, I do purchase all the WIC items because they have a box here at the child care center that you can put stuff in. So if it's items that they don't necessarily need or want for their own household, they'll donate it to the child care center. Okay, looks like my time is just about running out, so I'll wrap this up with kind of the considerations and limitations. So I just want to reiterate that the results that we found may not be generalizable to WIC in general, because we were looking at just participants in Cabarrus County. They use vouchers, not EBT, so the vouchers are going to have a different kind of spending behavior than EBT. All the women that we interviewed had children in child care, and all the interviews were conducted in English. So these were some of the suggestions that we had once we did this work. It seems like we've talked, among the Becker folks, we've talked a lot about starter bundles for WIC clients, whether to help them get started, maybe putting together a batch of WIC approved foods so that they can kind of get started quickly and easily, maybe having a certain section of the store that has all the WIC approved foods so that it'll be easy for people to pick them out. Pre-ordering WIC foods, I think, is a great idea and worth investigating more. Also, maybe working with low-cost stores. This would be in an effort to keep the food costs down, to make them WIC approved. We do quite a lot of work with dollar stores and pharmacies. Many of them are not WIC authorized, but they could be, and they also serve the low-income populations. So we've been trying to kind of work with them to see if they'll become WIC authorized. Also, simplifying the WIC approved food list would probably be a good way to go, and also maybe some more qualitative interviews. And that is it. Thank you very much.